how things are going with your work. Lisa, you might be on mute.
There, does that work?
That works a lot better, yeah.
Yeah, hey, great. Thank you so much, Libby, for asking and for sneaking me in before I have to leave to take my kiddo to one of their multitudinous doctor appointments. First of all, I work with Partnership for Patients at the Center for Medicare and Medicaid Services Hospital Information and Innovation Network program and the Transforming Clinical Practice program. I do two things. One is I represent patients on different events internally as we're talking about what kinds of things they want to share with hospitals or clinical practices. And I also network with patients all over the country with the help of fine folks like Libby and Lindsay to have patients speak on different events. Right now, in terms of webinars coming up for Partnership for Patients, we don't have much in the way of definitive needs before the middle of June, except possibly for somebody who has had pressure ulcers or bed sores who could speak to having to be readmitted to the hospital. So either as a patient yourself or as a caregiver, if you've had that experience, if you could get in touch with me, that would be great. And I'll type my email into the chat. Also, just FYI, I work also with Consumers Advancing Patient Safety, and we have started a monthly, actually every 3 weeks, so some months there'll be 2, radio program that originates out of Chicago but is available on iHeartRadio and will soon be available through the Sirius satellite network, Sirius XM satellite. And that program is featuring topics of interest specifically to patients with a viewpoint of how patients can act or respond. So those programs that have already been done are available if you go to the CAPS, Consumers Advancing Patient Safety Facebook page. There's been a program on medical finances with patient partner Desiree Bradley, and there has been a program on stroke and the warning signs for stroke. And coming up on Mother's Day, our friend Rosie Bartell will be addressing sepsis along with representatives from the Sepsis Alliance, including steps to take if you think you have sepsis, how you know that it could be sepsis, and what happens after you hopefully recover from a sepsis event. So that will be an interesting program. These are all available on podcast after they air. So if you, like me, will be doing other things on Mother's Day, you can still access that. And I think that's what I have to report right now. Thank you so much, Libby, for the opportunity to share.
Sure, it's always good to hear from you. So Lisa is a wonderful example of someone who's been working in this space, partnering in this space for many, many, many years, and who began partnering at the hospital level and sort of continued to expand her sphere of influence, if you will, to include state and then regional and now national efforts. So just to sort of put that into context for some of our newer advisors on the line, there's always ample opportunity, and we really just need to take a moment to celebrate that, because I can tell you when I started and when Lisa started many years ago, there were not a lot of requests for patients and family voice. And so I think Lisa's trajectory in this partnership is really something to celebrate for all of us, because it's made space for all of us here on the call to engage locally as well. So, anyone else? What are you guys working on? What are you particularly proud of that you're working on at your organization?
Can I ask a question, please?
Sure.
Going back to the recent Justice comments about sepsis, can you please repeat that information about a podcast? Or there was something,
Sure.
Did I get that wrong? Was a podcast? Anyway, I just got
Yes.
sepsis.
Okay,
and I asked because I know someone in Scotland who started off with a paper cut, and in a matter of months lost both arms from the forearm down and both legs.
Wow.
You know, because sepsis developed. And I'd like to,
Well,
this is Scotland, of course, but I'd like to follow up with her on this. So if you, if you have a number or a reference, or even email it to me if it's easier.
I sure can do that. If you want to type in your email address, I can send you information. Rosie Bartel is the patient who will be on this radio program on Sunday, May 13th. And she has lost her leg to sepsis. So she certainly would understand your friend's situation. But it will be available. The radio program airs live on Sunday at, I believe, I don't have it right in front of me, I should, but it's at 2 o'clock.
I'm just going to find where I can type my email. I'll have to.
If I could interject, Lisa, if you want to send me the link where they could access that, then we'll send it out and follow up, Margaret. And we can also post it to the Yammer account.
Yeah,
that would be great. Thanks. Thanks, Libby. I
Sure.
was going to say it will be available first as a live broadcast and then as a podcast to access after that. So you can get it anytime. So we'll send Libby the information. She can send it out, and then you can share it with your friend in Scotland. That's I hope it's helpful for her.
Thank you. Yeah, great. Thank you so much.
Absolutely. Anyone else?
I don't know if I have a microphone. I don't know if you can hear me.
I can hear you, Bill.
All right. Well, I live in Saskatoon, Saskatchewan, Canada. I'm fairly new to this. My wife, Kathy, my wife is here as well, even though she's off camera. We live in a very highly concentrated neighborhood of senior citizens.
Mm-hmm.
In fact, it's the most heavily concentrated senior population anywhere in Canada.
Oh, wow.
Well, it's only about a mile square.
Really?
Roughly, I think. And Saskatchewan Health is putting in a facility at a mall across the street, a community health facility geared toward those 50 and over.
Great.
And it will include people of various disciplines. One of the features quite unique that they're trying to do is they want paramedics or other professionals available to come to your home. If a Friday night, for example, you're not feeling well, you don't know if you should go to the emergency ward or you can take an aspirin and go to bed. And they would send someone right over to you to assess this and tell you whether you should go to emergency, whether you should just relax and take it easy.
So how has your community reacted to that idea? Is that something that, people would have confidence in?
It's not very well known in the community yet that this is taking place.
Just growing it.
Fairly new, and up until it's it's up and running, I don't think they're going to be saying very much about it.
Sure.
But I think it's a great idea. One of the goals is to reduce the number of people heading to the emergency room.
That's an issue.
And thus reduce the backlog there. And another goal is to provide for an earlier release from the hospital to a safe, supportive environment at home.
I like it. It sounds very comprehensive.
Being nearby, you would be able to come home and have home care stop in to see you as needed and so on. And so, yes, it's quite an initiative, and we're still designing who all is participating in this health center. There will be some professionals who will be there on every Tuesday, for example. Others might be there on a Wednesday. Others would be there 5 days a week, and so on.
Well, I certainly hope that you'll keep us posted as this, continues to get designed and then launched. And
yes, thank you. Thank you.
Absolutely. And that is so much, the idea behind the network is to share practices like that and have, somebody else in maybe Britta in Duluth decide maybe we could do that here and really spread this engagement. So I thank you for sharing that. Well, sounds
you're welcome.
Amazing.
Yes. Here as well, as I said, we live in a heavily concentrated area of seniors, but there will be other facilities developed with the focus on the needs of other communities as well.
Right. Fantastic. Any questions for Bill? All right, well, we will look forward to hearing more about that, Bill. I really appreciate knowing about that. It's
Thank you very much.
Work.
Thank you.
Absolutely. All right, well, let me move on just a little bit. One of the community discussions that we wanted to ask today, I mentioned before that we often connect advisors to other projects or state or regional or national speaking, somebody's drawing on the page, other speaking events, and we do a lot of that connection. And with some of the engagement opportunities that we've connected over the last couple of months, it's come up more than once that it would be nice for an advisor who's participating in the network to be able to have something that sort of formalizes that that membership. So, for instance, Margaret, who spoke up earlier as a Sutter advisor who's partnering with the Sutter Health System to inform from the patient perspective, might also become a Patient Family Advisor Network member to support that. What do you guys think? Is there value to having some, and I don't even know what it is, and I'd love to hear your creative ideas because I'm not very creative in this space, but is there value to having a stamp, a pin, a logo, something to designate your membership in the PFA network? Any ideas?
How would that, can you hear me?
I can. Hi, Anita.
Hi. How would that be different from, I got a badge as identifying me as a Sutter volunteer. So and I think I signed up for the PFA network a long time ago. What would be the difference in my effectiveness, in my access? What would be the difference? What would be the add-on?
Of identifying or having a declaration?
Yeah.
Or of participating?
Well, so far I haven't been offered a project to participate in, so I'm a little frustrated about that. But in any way would it make a difference? I thought that the badge that I don't have in my hand right now was part of the PFA network. And apparently it's just Sutter. Maybe Margaret can clarify that. But Anyway, the broader picture, the broader question is, what would be the added value to having an identification as a PFA network member?
So I guess one thing I want to.
Badge, Anita.
Yeah, I have one of those.
Yeah, that's the badge.
Is that the PFA network badge or the Sutter badge?
It's the Sutter Health East Bay Medical Foundation, and it identifies me as a patient advisor, quality department. And there's
Okay,
another.
so one second. So, Libby, what you're saying is you're asking if something beyond that would be useful?
So let me go backwards just a little bit and differentiate between your work with Sutter and your membership of the PFA network. Your work with Sutter is distinct based on your patient experience with the Sutter healthcare system. The PFA network is a national network of advisors serving in similar roles to other hospitals and other healthcare organizations. And the purpose of the network is to support you as an advisor in your role of partnering with, in your case, Sutter, or in another case, Memorial, or in another case, Dayton Children's. So this network is a national network. It's external to Sutter. And it's, if you want to think about it as a professional sort of community, right? So if there's, if you're a journalist, there's probably, I'm imagining, totally speaking off the cuff, I imagine that there's a journalism professional society of some sort. So that's the role that the PFA network serves. And so the question is, does being a part of that sort of, quote, professional organization provide you additional value? And that's my question to you. I'm not, that's what I'm trying to understand from the community.
I would think that it would provide events like this meeting and other meetings that are informational and educational. So certainly that's a value added to just the local, let's say, Sutter involvement.
Mm-hmm.
Would we be asked at any time to identify ourselves as a PFA network member when we have our Sutter badge on?
Likely not when you have your Sutter badge on. Where it's come up and where I've been asked about it has been when we connect a person to, for instance, a research team or a measurement development team that's working nationally beyond the local organization. And so I think that's, more where the question has come up, and that's why I'm bringing it forward here. So I don't see, it wouldn't make sense to me to have a designation on top of your Sutter badge in terms of your work with Sutter, although maybe it would. I don't know. I'm really open to learning.
Hey, Libby, this is Daniel Wells. Can you see me and hear me?
I can. Hi, Dan.
Hi there. Good day to you. I also am a PFA within Sutter in the Sacramento area. My wonder is, as we become more prevalent in the health community, like you said, whether it's a research team or otherwise, if there's some level of standardization that this community would bring to us, or certification, I'm wondering if then that's when sort of a badging or sort of sealing of who we are would be a value. So similar to, I'm a project manager by trade before I became a stay-at-home dad. And so there's the whole PMI organization, which I think is probably not quite as similar as this, but on a smaller scale is similar, and they have a certification process that you go through to identify yourself as a project manager that's certified.
That's a really interesting question. So that concept of certification has certainly come up in a lot of different places. And I think that there's tremendous value to it. I will share that my concern with it, and the reason we haven't gone in that direction, although I need to stop thinking of the issue in black and white, do it or don't do it kind of thing, because the downside of a certification program is it creates a sense of exclusivity that I'm really uncomfortable with. So
Right.
as much as we're trying to engage our vulnerable populations and our diverse populations, I feel like a certification program would further kind of dissect that. But I'd be really interested to hearing some thoughts about how we could still continue to work to engage our vulnerable populations as advisors and still kind of raise that standardization practice.
Yeah, so I know, like, for example, and the other folks from Sutter can equate to this. I've been doing this since September, so I've only been through kind of a portion of a year of this, is that Morgan sort of coordinates a gathering of PFAs and provides some level of system-wide training on that day away, that workshop that we do. There's another one coming up, and I believe somebody from this organization is going to be speaking.
Lindsay.
Yep. Awesome. I'm looking forward to that. I should be there. And so maybe if there's some level of level setting, not necessarily, a certification or an exam, but to basically say that, yes, I've been through this process that, this organization endorses, and I'm better able to be the best PFA that I can be. Instead of saying that it's sort of an exclusive club, it's sort of open wide the doors, but provide some level of content that basically provides a level setting for us.
That gives me a great idea and a way to go about, not having such a black and white view. So what you just suggested then maybe is attaching some sort of declaration and identification, whatever it might be, to one of the programs that we offer, which we offer for free. So like the core competencies of effective advisors, or the QI basics or something like that. And since that is available to everyone, anybody, whether they're partnering with Sutter or any other organization, to attach it to that makes a lot of sense.
Is there anything involved in becoming a PFA network member beyond filling out the form that is available someplace, I can't remember where, that I filled out a long time ago, and I thought, okay, I'm a PFA network member.
So to answer your question, no, that's it. Anyone who is interested and or already partnering with a healthcare entity from the patient family perspective is invited to join the network, because we're trying to raise the community of advisors and be incredibly inclusive as we do that. So that's why this idea of maybe attaching it more to the programs, which gets to some of those standards of practice, if you will. And because those are available free to anybody who wants to join them, maybe that's the thing to attach this piece to, rather than just attaching it to the network itself, attaching it to the training. Another
value to this would be for project teams, of professionals within the clinical community or within the non-clinical medical community, to understand how to operate with an advisor. Because I think that sometimes, the few times that I've been a part of our monthly meetings, and then the one time that I was involved with the project, I think there's still some hesitancy to understand. So what can we do? What should we be doing? How do we engage with this patient? Should they be sharing their personal stories? Should we be sharing other patients' personal stories? That kind of information. That might be a helpful thing to come at it from both directions.
Yeah.
Say, this is how we as an advisor can operate. And then your clinical community, this is how these advisors operate and how you can leverage them.
I believe at our last meeting, there was some discussion about sharing the content or the results of that meeting with the doctors at Sutter, specifically Dr. Birnbaum, who's also my physician. And I checked with her, but she hadn't received anything. And it was one step, I thought, towards, she knew about this program because she's the one who urged me to become part of it. that was the extent of her relationship to it. And I thought that we discussed that and that some action was going to be taken. I don't have any notes from the last meeting, so I can't follow it up with hard copy.
So again, that would be a conversation for your Sutter connections, right? And this and that follow-up is really important. So I'd certainly suggest connecting with your facilitator to figure out where that went.
Okay.
Could I ask a question or make a comment, please?
Sure.
Regarding becoming, identifying as a PFA network member, I'm like Anita. I still haven't been assigned a project, and this is what I thought I was signing up for last year, to be working on projects.
Mm-hmm.
And so I'm attending meetings like this, but I know spending an hour, which is fine, but I'm still not doing what I had signed up to do. I've been doing bits and pieces of, my own ideas and making little reports of that, but it's still not a project that's recognized by Sutter that, we're supposed to be working on.
Mm-hmm.
I think one is coming, but we, took one step to get our badges, but we're still not doing it. So I feel that for me right now, that would just be more busy work rather than doing what I would, what I thought I was going to be doing.
There was an email not long ago mentioning some future, like in May, communication or event.
Yeah.
And, do you know what I'm talking about?
Yes.
And I do, Anita. That's the event that's happening in Sacramento. I believe it's on the 24th.
That's right. And I'm going to try and get to that.
Yeah. And there was and the one that I went to was in Fairfield or Cordelia. I can never remember exactly where it is.
Fairfield. It was in November, Dan.
Yes.
Because I was there.
You're really tiny on the screen, so I'm not sure if
I am tiny.
well, on the computer screen, I mean.
So, is this any better for you?
Oh no, that's fine. That's fine.
You may remember. I have a walker. I use a walker.
I remember the brogue. My wife is Scottish, so that definitely plays me in.
Okay.
Go ahead, Dan.
No, but I was going to say is I think that my comment about sort of helping the medical community, the clinicians that are within our hospitals understand what we can do would be a great tool that a group like this could share, let's say with the Morgans of the world, with the Jessicas of the world, who sort of coordinate us to help them get more projects on their plates.
I'm behind that 100%, and I'll work on it.
Great.
I would be happy to work on that.
Yeah.
Excellent. I love the idea. Let us, sort of marinate on it. And Dan, I welcome you to sketch out some ideas and shoot them over. And certainly, as we've developed other work groups around, the IT National PFAC, as well as qualitative research, we can think about whether we could take that on as well. Because I think
I know our hospital has been at this within Sutter for longer than other hospitals within the system. So maybe Jessica, and myself and other folks on the committee within Roseville can sort of identify what's worked for us. And then that would be a good best practice sharing to bring that.
And again, the opportunity here on the PFA network in this call is to get that sort of run through other organizations, like we have Dayton Children's on, and we've got our friends in Canada and others. So get the outside Sutter perspective on that as well.
Which is why I think Jessica and Morgan forwarded this to us to become part of this, because of those opportunities.
Exactly. Well, we would love to work on such a thing with you. Right. Definitely. All right, well, I'm going to stop this conversation here because we actually had more, but we'll just give a quick report. So one of the projects of this that has developed out of the PFA network is the evolution of the National IT Patient Family Advisory Council, We recruited, put out a call for recruitment. Anyone was welcome to respond to. We did applications and interviews and onboarded 12 advisors from across the country onto this national IT PFAC. So I'm going to ask Lindsay to just kind of walk us through our first meeting and the launch and how excited everybody is.
Sure. Thanks, Libby. And yeah, we are very excited to have gotten started last month. Again, Libby said we have, I believe, 10 advisors on and participating, all very excited. On our first meeting, we did introductions as per typical first advisory council meetings go. Our meetings are a little bit different than most. I know some advisory councils meet online, but because of the national aspect of this advisory council, we do all of our meetings on Zoom like we are right now. But everyone had a chance to introduce themselves, and it's just simply incredible the vast amount of experiences that all of these advisors have, and we are so grateful for all of their participation on this council. Our first step is going to be, well, we asked our council to go back and look in their patient portals and give a report on how many steps it takes to access your after visit notes, either your physician notes or your after visit summary. And so we're really hoping to gain from that a better understanding of really how different all of these vendors work and these patient portals work, and how many steps it takes to actually find your notes, how easy is it, and really what's the difference between all of these different vendors. So
would you explain, I know what a patient portal is. I use My Health Online all the time. Does every hospital have a different vendor, a different setup, a different
each organization has usually has electronic medical records, and those are provided by a variety of different vendors. A few of the more popular ones being Epic or Cerner. And through that, those communicate to your patient portal that you've used before. And so that's the question, is how do these different vendors communicating with the patient portals, how easy is it to access your physician notes or your after visit summary notes based on these different vendor setups?
So if I only use the one, I guess Sutter uses Epic, and I have no way to compare with another one, is there any way that I can be useful in any way with my experience on My Health Online?
Well, we at this point, we're just starting out and gaining the experience of those who are on the council, and Open Notes have a lot of data based on many other organizations. So we'll start there, but if we see that expanding, then I think a lot of folks can have an input there. But again, we're just getting started in talking about navigating to your notes, starting with the council members, possibly expanding, but then moving on from there. And we're really excited to be starting this journey.
Lindsay, can you explain what Open Notes is? I see the fancy graphic on the slide.
Yeah, so our organization, PFCC Partners, we've partnered with Open Notes to develop this IT PFAC. Open Notes is actually a movement. They work with many organizations, hospitals, and healthcare organizations to support the sharing of physician notes. So during a clinic visit, your physician will have taken notes about your visit there, and then they put that into the electronic medical record via Epic or Cerner. And many organizations, I don't know how many, but we can go to their website and find out a lot more information. But many organizations, the physicians have started sharing those notes with the patients. And that has really helped the patients in a variety of ways in understanding a little bit more about their care and their visits and remembering things that they talked about during their visits. And so yeah, it's a movement that is really pushing this this idea forward, and they've done a ton of great work. I think the website is opennotes.org. So you can go there and find out more information and see where in the country these organizations are sharing notes.
So Lindsay, is this for sharing? I mean, I get a summary every time I go.
Right.
So and it has meds on it and specific things that Nina and I discussed. But she's often typing away throughout the whole appointment. So Open Notes would be that content, the conversation that we have on various things that may or may not be directly related to what I came in for. Is that what Open Notes would have, or would just have the succinct version that I get?
So Open Notes would be everything she's typing in while you're talking to her.
And so the proposal or the question is that those Open Notes be shared with whom?
The Open Notes movement exists in hospitals and healthcare ambulatory centers, so that when you go into your patient portal, there's a tab there that says you can click on and you can see the actual note.
Only I can see it, or somebody else has access to it?
You and your physician.
Well, me and my physician, yeah. So it's not, for example, if I go into the hospital and they have access to my record at Sutter, will they have access to all of that?
Yes. They have access to physician notes anyway. As a patient and a family member, you're the one that doesn't have access.
Mm-hmm. Which is crazy.
Oh, I see. So, well,
they already have that. We're just the newcomers to our own party.
So Lindsay, one of the things that concerns me, not about what you're doing, I think this is awesome, is the fragmentation of independent physicians. Mm-hmm. So for example, both our primary care physicians, my wife's and my physicians are independent. Mm-hmm. Our kiddo's pediatrician is independent, but is connected into the Sutter network and into My Health Online. Our primary care physician for us for adult medicine has their own sort of portal that's somewhat antiquated, but it's not connecting. And is part of what you're doing advocacy to sort of bring those type of clinics into the mix to make sure that our records are all integrated and available?
It's a good question.
Yeah. So I think, Dan, again, this advisory council launched last month.
Sure.
The vision that we have is to create this partnership and bring awareness to the kinds of issues that you just raised.
Yeah.
So I think, our effort today was to bring you back a report in terms of this group has launched and is a touch point for us to get your kinds of ideas and thoughts and be able to take it to this council. So it's both ways, right? We want to bring out what the council's working on. We also want to hear your ideas and thoughts that we can bring forward. So I think that is a really important point. I think and certainly something that we can add to the agenda for some discussion and awareness raising. I see this advisory council as being very new into the space of IT, right? It just, we haven't had that kind of in the IT space before. And so I think this initial, 6 months to a year will be awareness raising of what are those issues. And so I appreciate your comments.
Mm-hmm.
Yeah, I have a background in IT before I stayed home with our daughter and took care of her. So I would be very interested. I didn't know about this and the vetting process for the folks in the committee, but given what I'm doing from a schooling perspective in healthcare analytics, this is something that very much interests me, both as a patient, as somebody who wants to work in the medical field. So we could maybe Lindsay, you and I can talk when we see each other in.
Yeah, definitely. Next
Wonderful.
couple weeks.
Yep, exactly.
And I see that we are actually 2 minutes over time. I'm going to quickly scroll through, and then Lindsay, I'm going to ask you to hang on because Anita was a little bit late to the meeting and didn't get a chance to see the Yammer demonstration. If you don't mind taking the screen back and showing that again.
Mm-hmm.
So in terms of, thank you for the robust conversation today, absolutely, on the sense of community. In terms of skills exchange, things that we have coming up, the core competency trainings. Again, information on all of these can be found on the website and on Yammer. We're trying to get things out to you in a variety of different ways and make it easy as possible. In development, and we can discuss these more next month, is the measurement basics. So we have the core competencies of effective advisors being the foundation for advisors. We have a quality improvement basics. We're now developing a measurement basics because measurement teams are looking for advisors to inform that work. Shared decision making is an important skill and effort in the environment right now to raise awareness around shared decision making. So we'll spend some time on that next month as well. I also wanted to garner, what kinds of skills development you're being offered at your home organizations as well. So I will save this slide for next month for more robust discussion. Engagement opportunities as far as the PFA Summit is June 10th in Baltimore. Anyone who is planning to attend the Institute for Patient Family Centered Care conference, we would invite you to come a day early for the summit. There's no charge for that particular event. The second is the UPMC Story Booth. There's a research team out of the University of Pennsylvania. I don't know what UPMC stands for. It's somewhere in Pennsylvania. And they are looking for patient and family stories. If you're interested in supporting that effort, the full request is on the website under the engagement opportunities, and we'll also post it to the Yammer. So I apologize for running 5 minutes over. I'm going to stop sharing my screen so that, Lindsay, you can grab it. And I thank everybody for joining us today for, again, another robust conversation, and look forward to being in touch with you in the interim. Have a great afternoon.
Lindsay? She's gone. Okay.
Nope, she's
I'm
on.
here. Sorry, I was muted.
Oh, okay. All right, so how do we connect on this thing, or should we do it in another way?
Well, I can just quickly go through it. I'm not exactly positive or sure of the log-on issues that you're having. I can walk through how, because I've invited myself to join,
Yeah.
so I can show you how that has worked for me. I don't know if I've finished it, but I just want to make sure. So did you receive an email like this?
Let's see. Yeah, I accepted the invitation.
Okay, so you accepted the invitation and went here.
Where's here?
Right now, so when you clicked accept, it should have brought you to a screen like this.
No, when I accepted the invitation, I got a screen that said, enter your business email address, and you will be sent a link to join. I entered my private email address because I don't have a business one, and I did it 2 or 3 times and I never got a link. So I can find
I can send you the email again. I can invite you again.
Okay, let's do that.
So then once you receive it, all you should have to do is click accept invitation. And so when I click that, it takes me here. And I say, I want to start a new account under my email address.
Okay, perfect. I'd appreciate that.
Yeah. And then it'll have you set up a new account with your basic information, name, password, and then your job title, and it will be connected to your personal email.
Okay, great. Well,
okay. I'll do that again. I'll send you one right now.
Okay, thanks very much.
Okay, no problem at all, and thank you. Yeah, we'll we'll keep in touch to make sure that this works.
Can I answer one more question to me that's probably really stupid?
No, that's okay. No stupid question.
So all the time that I've been connected with PFA over the last several months, there's been I've been having trouble making the distinction between PFAnetwork and what is it that Morgan heads up? What is it Morgan's involvement?
So the PFAnetwork, this is a national network of patient family advisors under our organization, PFCC Partners, which our headquarters are in Long Beach, California.
Right.
At Sutter, Morgan, she works for the Sutter Health Office of Patient Experience, and she does all of the patient family engagement work at Sutter Health specifically. And so at Sutter, you do have a large community of patient family advisors, I think over 100 now. And so she is your go-to contact for anything Sutter Health related.
Okay, so she's the person to go to then with my frustration about not being offered a project, not having an assignment.
Yes.
I'm spinning my wheels.
She would be your contact for questions like that.
Okay.
For Sutter Health specific.
She's away this week, so
okay.
I'll catch her next week. I'd very much like to be able to go to Sacramento, but we're going to Chicago. So Memorial Day weekend's kind of an odd time to have a meeting like this when people often go away. Anyway, thank you very, very much, and I look forward to getting your invitation.
Yeah, no problem.
Anita, this is Libby. If I could just maybe provide a little insight to your I hear your frustration at not being more involved at this point. I would just encourage you to recognize the evolution of the advisory efforts at Sutter. And I'm not sure of your particular organization and how long they've had these advisory efforts, but I can tell you that the Sutter enterprise as an organization has been going for just about 2 years, a little bit more. And so all of this work is really new. And I think if you can see yourself as a partner in the evolution of the advisory program itself, that would be really helpful. And so I would say, you know, I hear your frustration and taking that forward in a way that creates opportunities to expand project uptake, I think is a really positive thing. They need to hear that. However, I would also offer you yourself as a resource to solving that problem at the same time that you're recognizing it. And so one way I'm thinking you might do that is to say, you know, I recognize Sutter is new in the evolution of this advisory partnership. And I recognize that the organization I'm partnering with may not have as many projects because the staff at that organization are not thinking in this capacity.
Okay, when you say the organization I'm partnering with, who are you referring to?
What Sutter affiliate are you working with?
Sutter East Bay.
Okay, so Sutter East Bay. So Sutter East, I recognize that Sutter East Bay has not been partnering with the advisors for a very long time, and that's why there likely aren't a lot of projects. So how can I help to create more opportunities? Maybe you suggest doing a low-hanging fruit project, such as, I don't know, a staff appreciation event, so that you start to get that foothold. So you're still in the process of building the relationship with the organization in order that you can create more a partnership. But that organization is very young in that relationship development, so they need your willingness to evolve with them. Does that make sense?
Yeah, I thought Lindsay just said, however, that there were over 100. You didn't mean Sutter East Bay, then you meant Sutter total.
I meant, yeah, Sutter in general, the entire Sutter enterprise. So spreading.
Well, I would be more than happy to have that conversation. I assume it's with Morgan that I should have it.
And who is your East Bay contact? Who's your facilitator?
I have no idea. Nobody's contacted me.
Okay. then Morgan would be the right one to have that conversation with. So yeah, I mean, and again, I would say, and I've been in your shoes, I've been an advisor for 25 years, and I've been on the front end of a lot of advisory program development. And so I know how frustrating it can be. But I also know where I've been effective in the past and where I haven't. And where I've been effective is going in and saying, look, I'm frustrated because of this specific issue. Here's what I see as a solution. Is there something I can do to create a solution?
Sure, great. I'm happy to do that. And I love your t-shirt, by the way.
Thank you.
Very cute.
Thank you. I got this from an artist in New York.
Very cool.
Very beautiful. I love it.
Thanks.
Anyway, thank you both very much. And I will look for your invitation, Lindsay, and act on it, and write to you if I can't do it.
Please do. Yeah.
Okay. Thanks very much, both of you.
Thank you. All right. Bye.
Bye-bye.